Hi, we'll start this Facebook live broadcast now. I'm not sure if anyone's online yet, but we'll just kick off. So just to explain what today's about, and also what we'll be doing in the next couple of weeks. So after last week, which if you watched, was a kind of general question and answer session with Emma and myself, and we thought it'd be good to talk to people who've done the MSc at UWE and to give you some ideas of what the course is like and what you might get out of it. And so we'll be doing that hopefully over the next few weeks. And today we're talking to Janet, who has done the Masters here and currently also works at UWE. So we'll just be having a bit of a chat, asking some questions. You're free to ask questions yourself as we go along. We probably think it'll probably take about 15 to 20 minutes, but it depends how many questions we get. So we'll just see how it goes. And so first of all, just say hello to Janet, and thank you very much for being the first volunteer for the sessions talking to the alumni of the MSc.
No problem. Hello everyone, I'm Janet. As Paul said, I work here. I also did my Masters in Public Health here. So yeah, it's great to be able to share some of my experiences with you.
Yeah, so first of all, I thought it'd be good just to talk about what kind of your background was and where your interest came from in public health and why you actually decided to apply for a Masters in Public Health.
Okay, so I had my first degree in biochemistry, and after the course I realized that I wasn't really interested in doing much of the science, but I was probably more interested in the social science, and I had quite a number of opportunities during my studies to engage in some public health campaigns, and I did a bit of work with some non-governmental organizations, and that opened my eyes to a different field, and that the public health field. So I realized that in Africa, and I can say to a very large extent in Nigeria, if you want to practice public health, you're going to be competing with lots of medical doctors who are already in the field. And without having a degree in medicine, I realized the only way I could sort of compete and get a very good job, as a public health specialist, would be to go and get an advanced degree in public health. And so that sort of spurred the whole idea of coming to study public health and on master's level. Yeah.
So did you have any other options when you applied to the MSc at UWE? Did you apply to other places, and did you think about other options?
Yeah, to be honest, yes, I did. So the first question for me was what country to go to, because I was coming from Nigeria. So I had a number of different options in terms of countries, but I started streamlining them by English-speaking countries, and so I had US and the UK top of my mind. And at that point in time, several students were running to the US, but I looked at how easy it would be for me to get admission, what the admission criteria were, and the idea of doing GMAT and GRE and all those things which US universities would ask for put me off, and so I was left with UK. And so I had options, several universities in the UK, and to be honest, I did apply to close to about 20 universities over 2 years. So I do have emails where admissions, but I had to filter it down. And I think one of the things that guided filtering down was one of the things was location. So I have family in London, and as much as I really loved to be around my family, I did not want to stay in London. So I wanted somewhere that was relatively close to London, but not in London, so not to get distracted. And so I just turned down one admission from Glasgow because that was too far away. But so UWE was, Bristol is about 45 minutes away from London, which is really convenient for me. And I just thought, okay, I can start looking at places that are closer. But beyond that as well, I looked at the curriculum of what universities were offering. And so I remember a university offered public health as health promotion. Whereas when I checked on the UWE website, they did have public health as a course, and then health promotion was one of the modules offered. And beyond health promotion, we had to do something like policy, politics, economics. So it was like offering a wider context to public health, and I thought, why not go for something that would that will show you better, show you other areas rather than being restrictive. So I did eliminate some schools based on that, and ended up with UWE. But more importantly, I was able to manage to get a scholarship to study at UWE. So it was more like the icing on the cake, and it's like, oh, definitely I have to come to UWE. So
Yeah, that's good. It's good to hear about kind of the way you thought about location, in respect to London as well, because I guess if you're not from the UK, it might be difficult to sort of work out the geography in terms of how quick it is to get to places. I know on last week's session I was talking about London and the proximity to London. So that is obviously something that people do consider when you come from other countries, thinking about the capital city. But Bristol's much better than London, isn't it?
yeah, I love it.
You can visit London, but it's better to live in Bristol. So you mentioned about what led you to choose the MSc at UWE. I'm just wondered what were your experiences on the course. We'll talk about the challenges as well, but what were the kind of like big positives about the MSc? You can be honest, and you don't need to. There's no pressure.
So it was really a learning experience for me. It was, coming out of a different context, a different learning environment, into a new learning environment. So, I mean, I can go on and say all the things that I enjoyed about the course or about studying abroad. But one of the things was the opportunity to meet with people, from different parts of the world. I was just saying to my line manager that I was speaking to someone who was from Nepal. So we did a project together, and we still keep in touch. So the course and some of the modules that we'll take will enabled us to integrate, to speak to people from different parts of the world. We're able to network, and beyond that as well. I mean, there was a lot of support available to us, and ability to develop my own skills. So right from the first day I joined the course, I started looking for opportunities even outside of the course, in terms of looking at the university, what they offer in terms of developing my skills. So I was part of the student representative for my class, and that helped me in terms of my leadership skills. And I didn't stop there, so I still joined a scheme called the peer assisted learning, which helps new students every year. And so I joined the POWERS team, and I was a power leader, and it also improved my leadership skills, and these things look good on my CV. I have certificates for them as well. So I think the learning environment was one of the very positives that helped me develop myself, and perhaps also led to where I am today and where I will be going to in future. So yeah, quite a number of positives.
Yeah, good. Yeah, so the PALS scheme that Janet mentioned, it's a way of providing support, isn't it, for students, but by other students, so who actually have experiences already of being on the course. So that's one of the things that we're really pleased about, that we can offer to students, and the PALS representatives are always really great in terms of the commitment they show to helping other students. That's really great. What any challenges in terms of the MSc? Anything that was a bit tricky that you managed to either overcome, or maybe didn't overcome?
Well, if I didn't, I won't be here. So yeah, well, there were also lots of challenges as well, and I have to be honest with you about that, because coming from the context, I was used to learning in a particular way. I was used to writing exams by just reading the course content and not going outside of that, and just, well, we call it in quotes, la crème la pour, which means you cram something and you pour it down during the exam. It's totally different. Here you are being tested on your understanding of the concepts, and you're being tested on your ability to be able to implement these things that you're thinking about. So it's not just theoretical. So I think getting to understand that the assessment criteria are different was something I needed to just get my head around that. And then we had lots of support. There was a study skills session, run by one of the university staff, who was really good in telling us the expectations of the lecturers. and helping international students realize that there's a difference in terms of the context. So that was one of the challenges. And another one in terms of context was also my knowledge of public health was very limited to the African setting and context. So coming to a different environment and talking about public health, international public health in the global perspective, it was a bit difficult to sort of absorb all of that. But it's not something you just know instantly. It's something that with series of lectures, with consulting study materials, with reading of some of the reading lists and all of that, you get to understand the concept more. And the lecturers are quite helpful if you don't really understand. I was able to email, sometimes book appointments to talk about something. So yeah, the context was a bit difficult to sort of grab when I came in newly. The policies and things that are happening, in international context as compared to what happens in Africa. So it was a bit difficult. Yeah.
Yeah, it's a good point. We try and be as international as possible in terms of the way we teach. Obviously, because we're based in the UK, there is a definite UK flavour to the masters, and a lot of students want that. But over the years, we've made sure that we've kind of internationalised the curriculum as much as possible. So, but yeah, people are coming from all over the world really, as well as the UK. So it is, yeah, it can take a bit of time, can't it, to get used to the context. And in terms of the study skills, we often do find that either people who've come from other countries or people who are from the UK and haven't studied in a while, may need a bit of time to sort of get used to the different assessment methods, because there are exams, but it's, as Janet said, it's not all exams. So it's just about getting used to these different ways of doing things. So we have study skills sessions, which try and get people to acclimatise to this different type of working, and people tend to pick it up fairly quickly, don't they? Because everyone's quite bright who come on the masters. So, but yeah, it's one of those things that yeah, you need to sort of think about a bit when you begin, because there is that kind of like a different way of assessing things. So I know the answer to this question, but everyone else doesn't. So what did you do after the masters? Starting off with the, no, maybe this wasn't the first thing you did, but we'll talk a bit about the project you did with me and Amrit, but maybe that's not the first thing you did. So what did you do after you finished, or maybe even during?
Yeah, so I was going to say, well, my getting to the UK to study the masters, I already had things at the back of my mind of future plans. So that's why one of the reasons why I was engaging with trying to build myself in terms of leadership skills. So any opportunity I got really during the masters, I just took it. I remember I was part of the very first set of students that went on internship at Public Health England for some sort of shadowing, and that was really helpful. So I just put that in my CV as well. And at some point there was a call for student interns to work on a project for a couple of months, and straight away I applied for it. Some of us were shortlisted, about 4 of us got involved in 2 projects, and from the project I had my first publication in public health, and I was able to work with some academics in public health. So I was sort of building my sort of profile in terms of being able to conduct research, being involved and engaged in public health research. So it became apparent to me after doing my dissertation, and I chose to do a research-based dissertation as well, because I just wanted to do more research, that I wanted to do a PhD and I wanted to do research. And so I was torn, between looking for a job, as a research associate, or doing a PhD as well. And I wanted to do both. And well, people say you can't eat your cake and have it, but I'll say probably I did eat my cake and have it, because right now I am actually working as a research associate here in UWE, and I'm also doing my PhD part-time as well in UWE. So I looked for these opportunities, and I did get a couple of other opportunities which I turned down. And I remember getting a PhD studentship at the Open University almost the same week I got the job at UWE. So I'm not saying that if you come to UWE, this is what is going to happen to you immediately, but I think if you are determined, and if you let people know at the very onset when you arrive that this is what you have a passion in, this is what you want to do, there are opportunities. And like, I got an intern
Okay, sorry, we had a bit of a pause in the connection there. But I think hopefully you heard that. So Janet was just saying about if you make it known when you start what you're interested in and what your passions are, then we'll try our best to sort of work with you to think about how you might go forward after the masters, whether it's something at UWE or elsewhere. And yeah, Janet's one example of a few students now who've done the masters and are still at UWE in various roles, researcher roles, and some of them doing PhDs like Janet is. So there are definitely opportunities. And so in terms of your future career, what do you? I know you have got quite a good idea about what you want to do, haven't you? Because I've seen a nice diagram that you drew once when I was walking past a meeting with you and Judy, but only briefly. But yeah, so what do you think? You might have changed your mind by now. What do you think you want to do in terms of like medium and longer term? You don't, in terms of like, do you want to stay in academia, or are you thinking about other things maybe?
Well, I've got a list of things that I probably want to do, like you said, and some of them have been filtering down, just like I filtered down to get to UWE. So, but in the long run, I want to return, say, in a decade or two, back to Nigeria and take all these opportunities I have gathered in terms of learning and in the experience I've gathered, really, to see how we can implement changes, to see how we can develop the public health workforce, to see how we can make things happen, in Nigeria and Africa. But in the medium term, I'm really enjoying the research I am doing. I'm enjoying the fact that I'm learning different methods of doing research and the opportunities here in the UK. So I see myself, well, firstly, hopefully completing my PhD and then taking it forward from there, being engaged in research projects in UWE and working with other institutions and organizations.
Good. So it's not really sort of the time now, I suppose, to talk about any of our research projects as such, but one of the projects that Janet's involved in quite a big way is a Wellcome Trust funded project, which we're involved in, looking at the role of the built environment and health, and that links with another project we've recently finished with Public Health England on the same topic. And a few weeks ago we got the chance, didn't we, to go to Boston, to Harvard Medical School to present our report at a big planetary health event, which was a enjoyable experience, wasn't it? Very good. So there's exciting things that can come out of some of these research projects, and it'd be great for those of you who do come to do the masters at UWE, to get you involved if you want to be involved in things that we're doing here. So we've got people online. We've had about 7 or 9 people during the discussion. I've got some nice comments from quite a few people here, but no actual questions. I don't know if anyone's got any particular questions, then just do type those out in the next minute or so. If not, we'll wrap up the conversation. Question from Regina. Okay, so you talked about your PhD, doing your PhD. So what's it like? And what's the topic? What's it on? What's the PhD on?
Okay, so my PhD, the research is on understanding the barriers, the facilitators for physical activity among older adults from the Somali population. So just a bit of context, in the United Kingdom, we have a very growing number of Somali people, and because of the age at which they came in, many of them sort of like the first generation are in the 50s and above, and there's been a growing concern of physical inactivity among the population group, and generally the interventions that we do in the UK targeting sort of like the general population might not really work because of the specific population we're talking about. So it's more really trying to drill into what works in terms of intervention, development, and design for the Somali population that in that age category, and how can we get them more physically active? So that's the PhD. And but the other question about how is it like working and doing your PhD? I'm just smiling here because I wouldn't say it's extremely easy, but I would say that if you're able to be, if you're determined and organized, you know, you'll be able to, and the PhD part-time is not, it's not as strict in terms of the timelines. You can be a bit more flexible, and they give you up to about 6 to 7 years to complete it, whereas unlike the full-time, which is 3 to 4 years. So even though I'm working to finish before 6 to 7 years, obviously, but it's, the pressure is not as much as if I was, you know, doing a full-time PhD and doing a full-time job. So, but I'm able to cope, I'm able to manage. I hope I've been able to answer that anyway.
Yeah, no, that's good. Yeah, and she does work very hard, probably too hard really. Yeah, the report that's just come out yesterday, which was the Public Health England report, both her and Emma, who you probably saw last week, worked very hard on that. And it's good that that's finally out. It's very satisfying now, isn't it? But yeah, it is. I think part-time PhDs, I think, are great to do because it allows you to do a PhD while still progressing in your career, which can be a really good thing to do at the same time. But yeah, there are challenges in terms of trying to fit it in and not doing too much. But yeah, it can definitely be a very effective way of doing a PhD. Okay, so if there's no other questions, we'll wrap this up now. Oh, Ria, one more question. What other areas of public health are research that UWE interested in, or projects being conducted? Ooh, that's a big question. With lots of different areas really, but some of the main areas, and yeah, I'll say now, I might leave people out unintentionally, but some of the big areas that we work in are around, well, our area to start with, the easiest one for me to explain, is kind of around the role of the environment and health, looking at the built environment, so things like new housing developments and the impact on health of how they're designed, the road environment and how that impacts on health. And we've done quite a few projects around like both the general kind of built environment and the road environment, and so we look at kind of health and sustainability in that context. There's quite a lot of work in the department around kind of community development work. So Matt Jones leads quite a few projects looking at kind of community development and health, and so how the kind of community, kind of like community level, like bottom up level, approaches to health and well-being. What else have we got? My mind's gone blank. Emma and Jane, they do a lot of work around schools and physical activity, so looking at kind of children and exercise, and there's been some work around kind of body image, hasn't there, really? So work around young people. There's a lot of work around like kind of health economics, so social return on investment, which is looking at how to estimate, well, how to value the benefits of a health intervention, not just in kind of quite basic economic terms, but in like a wider societal value. So Richard Kimberley does a lot of work there. David Evans does work around, he's doing quite a bit of work around workforce development and also public and patient involvement. So looking at kind of the involvement of people in health and well-being. There's quite a team around that sort of area of work. There's work on young offenders, so looking at those who are in youth offending institutions and prisons. Nick Davigiani focuses on that sort of area, so looking at kind of vulnerable young people and the impacts of being in prison and young offenders institutions on their health. And then Stuart's done some work around migrants and health, migration and health. Who have I left out?
I don't know if you mentioned that Matt also does research relating to food evaluation of interventions.
That's right, and Judy's been involved in that as well. And Judy is a professor here. She does a lot of work around healthy universities. So she's involved in the Healthy University Board at UWE to ensure that the universities healthy as possible in terms of how it engages with students. So we've done a lot of work around healthy eating on the campus and other issues around tobacco and alcohol and mental health. Selena's done a lot of work around workplace health. And all these people you probably don't know, some of you know them, some of you won't, but you can go onto the UWE website and look at the research centre that we're in, well, the research team at the moment, and look at everyone's profiles and see the publications and investigate those kind of things that way as well.
In terms of the MSc, did I find the assignments?
So how did you find the assignments?
Well, like I mentioned earlier, I was sort of used to a different way of assessment, but coming here, I found there were various ways of assessment. So there were some of them that I was quite used to the exam type, which wasn't a problem for me. But I did like the fact that there were different ways of assessing students, and it's not all about just writing an examination. So for example, for the health promotion, I developed a website, which I still sometimes go back to check, and so impressive. I developed a blog on WordPress, and it was about tobacco prevention of adolescent smoking in Nigeria, and I used the concept for health promotion to design a prototype intervention, which I feel that can be used in lower middle income countries, especially in Nigeria, to prevent children and teenagers from smoking. We had assessment where we had to appraise some papers, and I did see that not all academic publications are really that, because sometimes we see things like that and be like, oh, this is really great, but after looking at doing critical appraisal, I then understood how to judge the quality of studies and to look at things beyond just the surface and see how the methodology. So they were quite enjoyable. They were quite nice, having a variety of assessments and being able to develop tools and learn from all of this. So yeah, good.
Yeah, good. Okay, so you're alumni of one of the tertiary institutions in Nigeria. How will the knowledge that you've acquired and the Western administration patterns of public health you've been introduced to at UWE be used in addressing Nigeria's realities? Wow, that's like a question in an exam, isn't it?
Exactly.
Good question. Janet's put on the spot now. Do you want to think about it for a minute? Well, that's the next question. Or are you all right? You can go for it.
Well, if you need more clarification, you can ask again. But like I said, the previous question of developing a website. Now, some of the things that we were taught were sort of like the theoretical aspect of which applies in any context, really. It's about the foundational principles. So for example, health promotion, we know all these models that we could use to implement and to try and change behaviors. And so it's about taking these models and looking at how we can apply it in the local context in Nigeria. So for example, and most of the assessment I did really, I was taking it back to Nigeria to look at the situation in Nigeria and how I could apply it and the challenges, because there will definitely be challenges that will be different from here in terms of implementing this program. So it was good. I attended a conference, Faculty of Public Health conference, just a couple of weeks ago, and there was someone from University College in Ibadan, UCH Ibadan, who presented a study that was basically taking something that has been developed, a model of engaging with people, public engagement, which I learned here, and applying it in Nigeria to try and tackle issues relating to primary health care. And it did work. The project has been on for 5 years. So I think knowledge can be transferred. We can transfer knowledge from one context to another. We can even interventions, but you do need to bear in mind the context and how it will be different in terms of your population. So I think much of what we learn here is applicable, But that's the essence of coming here anyways, so that you're able to learn things that you'll be able to go and apply back in Nigeria. So yeah. Hopefully I've answered your question, but you could, yeah.
Yeah, see, she's good, isn't she? Yeah, good marks there for that answer. More questions come in. So if you didn't choose to work for UWE, what other areas would you have considered? So I think this is like after the Masters. If you hadn't have stayed around here, you said about the studentship, didn't you? So you had the offer at the Open University in Milton Keynes, which we managed to persuade you not to take.
Yeah, well, so like I said, I got a PhD studentship fully paid for or sponsored but by the Open University, and I had to leave that because I wanted to stay here. The people here are great, not because I'm with Paul.
She has to say that. Yeah.
So yeah, it was.
But you did stay, so it does show that you mean it.
Exactly.
Yeah.
So, and if I hadn't gone for the scholarship at the Open University, I'd also been looking back, because I'd worked with some non-governmental organizations in Nigeria, and I was also looking back to, going back there to implement some of these things I've learned. So the likes of FHI 360, Society for Family Health, there are organizations I thought, okay, I could work for. And there was a program I was quite interested in. I think I am still a bit interested, but I don't know how it quite fits with my schedule at the moment, which is the Public Health Consultancy Training Scheme. It helps you, it's a 5-year training course, which is open for anyone who wants to, who've got public health experience and want to go on that training, and it just exposes you more to the field, and you're able to work and learn at the same time. So that was something at the back of my mind if I hadn't got any of these opportunities. And yeah, there were so many other things to consider.
Good. Are there any exams? Yes, there are. I don't know if that's good news or bad news. But there are a mix of assessments. So what tends to happen at UWE is that a program, so like an MSc, it'll be looked at by the university to make sure that there's a range of assessment types. So, for example, you have a mixture of exams, assignments, presentations, and then web design and things like that. So you're always going to get a mix of things, really. But there are a few exams on the masters, but yeah, at the same time there are lots of other things as well, including assignments. What advice would you give us? What should we expect from the programme?
That's a huge one.
Diversity of topics, I suppose. And
yeah,
like
I was going to
really?
say that. I just come with a very open mind. When I initially came, I did think that people who studied medicine would be at an advantage in terms of they probably I thought the course was going to be medicalized, and that it will favor those who did medicine. But I came here and said that we're just on the level playing field, really, and everyone is able to learn different aspects. I mean, there was several courses, politics and policy, and these are things that actually public health issues as well. So just come in a very open mind, try and get as much as you can get out of it. Enjoy your stay in Bristol. Bristol is a beautiful place. Don't be like me. I didn't really go out so much, and I'm just doing that now. But yeah.
Yeah, lots to see. There's lots to see. We were thinking of potentially doing something in the next few weeks where we actually show you the centre of Bristol. So have a bit of a look around, Adrian. Have a look around the centre of Bristol, and just give you a bit of an insight into what it's like. Obviously, you can look on the internet and find out as well, but it might be a bit of fun to do that. And there's a graduation ceremony coming up, and it may be that we do something from there. But yeah, I don't know. It depends really, because we won't have Wi-Fi, so it might be a bit problematic to do that. But you never know. We could just video it. Yeah, you're right, and then just post it online. So if that's it, then I think we'll just finish there. So we've just done over half an hour, so probably longer than probably we thought we might do. But I hope you've enjoyed it. The next episode is next Friday at the same time. It'll be Emma instead of me, and it'll be Nazrul being interviewed or being talked to. So Nazrul also has done the MSc, but took a bit of a different path afterwards, but is coming back to UWE again. Yeah. So hopefully you'll find his story interesting. I'm sure you will, and we'll be doing other sessions as well in the next few weeks. So and we'll be varying things around. So hope you can keep watching. And if you can't catch the live feed, then obviously these videos will just stay on the Facebook page. And you can watch them whenever you like. So I hope you found it useful, and hope to see you next time. And thank you, Janet, for taking part and being the first person to talk to.
Yeah, I hope I did well.
You did very well. Bye-bye.